All right, hi, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment here. We've already harvested two very nice hamstring tendons. They're a size 8, and that ought to be a nice new graft once we get that in position for you. Now we're looking at this meniscus where you've had, I think, prior work. Just seeing if there's anything that needs our attention. Your meniscal root looks okay. Sometimes that tears, and we have to repair it. But that root there looks pretty good. This is the area in the body, or really at the junction of the body and posterior horn that we were concerned about right here. Again, prior work, but I don't see anything new. We're going to turn on the suction. Sometimes that helps us determine if something's stable or not. Probe. Okay, so I think we're done. I just wanted to make sure there was nothing that could catch. And again, you've had prior meniscal work, and the problem really has been instability. So we're going to go ahead and stop there. We're going to look in the central part of the knee. This is where the ACL is absent. So we'll put in our shaver here and just do some preliminary work here just so we can identify the space. And as we expected, there's no ACL in this notch at all. With a size 8, we ought to have plenty of room. That looks pretty good there. This is maybe the remnant of the ACL right here. And the new graft is going to come out through the tibia right about where my shaver is right there. Okay, we're going to look in the lateral compartment next. That's the posterior cruciate ligament on the left there, but now we're going to look in the lateral compartment. Let's go ahead and... Okay, so now we're looking in the lateral compartment. We're just adjusting our tubes real quick. Okay, so this is the lateral meniscus. This posterior horn of it right there. The root looks good. Body looks good. Down at or at the top of the screen at 12 o'clock, we can see the popliteus tendon running at an angle behind the meniscus there. And the rest of this meniscus looks good. What's encouraging is the articular cartilage looks good also. So I think there's not much more to do on this side. We're going to use our shaver just to make sure there's no loose pieces of meniscus. I thought I saw something there for a minute. Okay, so here's our shaver coming in. And we'll just clean out the compartment. The next thing we're going to look at is the patellofemoral compartment. Okay, so here's the trochlea and the patella at the top of the screen here. And right now we're just using the suction feature on the shaver more just to irrigate the area, make sure there's no loose pieces. Looks pretty good. At the top of the screen there's the patella. And then the trochlea again is this groove that the patella glides in right down here. So we're going to keep working here. We'll show you some more in a little bit. Yeah. Okay, so we're looking in the notch here. This shaver is basically running along the path that your new graft is going to take. And that looks pretty good. Plenty of space. We can see all the way to the back of the knee. And again, the graft's going to come out right about here, and it's going to run just basically like that. Okay. Okay, so we're pulling the graft, your new ACL, into position here. And we can watch it disappear into the femur. We've got some lines so we know how far to pull it. We'll get this position unlocked and show you some more in a minute, but that's it going up into the bone there. Okay, so there's the new graft in position. It's locked on the femoral side. It's got good tension on it when we hold. You can see how that runs into the tibia there. I'm very happy with the way that looks. We're going to go ahead and fix things and get you back to the recovery room. So good luck to you now. I'm really happy with the way that looks. Okay, I'm going to turn on a little bit of outflow here. And there's your new graft. Okay, good luck to you now. Bye-bye.